Thank you, everyone, for yet another spectacular discussion. I'd now like to welcome our next panel, which will discuss why investors are excited about the potential of inclusive healthcare in Asia. This panel is led by Dr. Erik Berglof. Dr. Berglof is Chief Economist at the Asian Infrastructure Investment Bank, a multilateral development finance institution created nearly 6 years ago. In this capacity, he sets the vision and strategy for the economics department and has a strong focus for healthcare and inclusion. Please take it away, Dr. Berglof.
Thank you. So sorry, we had some problems here with the technology. I'm very excited about being part of this. I landed at AIB about a year and a half ago as in the middle of the pandemic, and I landed at an institution that had done nothing on health before the pandemic, but then did almost everything in health in the pandemic. And I was actually tasked with building up a more sustainable approach to healthcare, and we have since established what we call a social infrastructure department that does health and education, but actually for now mostly health. So I'm very excited to have this very experienced group of panelists, and obviously this is a focus now on asset managers and capital owners, and how they can contribute to developing an Asian healthcare that is truly accessible and inclusive. And I don't probably need to introduce everybody, but what we could do is that we start from what have we learned from this pandemic, and how does you all have a lot of experience from developing healthcare in Asia. So what have you learned from the pandemic that changed your mind or reinforced some views that you had before, or what are the most important priorities? Jennifer Buckley, can I start with you, founder of Sweef Capital? You're based in Singapore, I understand, and is that correct?
That's correct. So Sweef Capital as an investment fund really looks at market opportunities or investment opportunities driven by the fact that women are undervalued in key segments of the economy. And from the healthcare perspective, it's very much a sector where this is the case, where we are under-recognizing the fact that women are key actors within the healthcare system. And from the pandemic perspective, I think what we saw, it just reinforced the picture where all countries were recognizing the fragility of their healthcare systems, and at the same time, the importance of having adaptive systems with a deep and qualified healthcare workforce. And coming back to the point that I'm making about the central role of women and in relation to these fragilities of the healthcare systems, women represent 70% of the healthcare workforce globally. They experience greater barriers to accessing effective care. And at a time when we have 80% of household decision-making going into the hands of women, women actually play a key role from a consumer and patient empowerment perspective in really being quite thoughtful about investing in health and well-being globally. So we have a census affirm that empowering women within the economy, and particularly within healthcare, is going to enable us to achieve our global goals around health and well-being. And to maybe just give a few other contextual aspects. From the healthcare workforce perspective, it is one of the biggest and fastest growing employment sectors globally. And 7 out of 10 of healthcare workers are women, and they are contributing $3 trillion annually to global health. And half of that balance is effectively through unpaid care work. So I think the pandemic really reinforced the fact that we need to really think about these disparities in healthcare that result and lead to women being underdiagnosed in healthcare systems, undertreated in healthcare systems, underserved, and in effect are leading to poorer global health outcomes.
Well, thank you, Jennifer. Actually, I think you could probably make an even bigger point is that, if women had more influence over decision making more generally, healthcare would be have higher priority. I think that's what we learned from a lot of development work. Ray, can I turn to you? Ray Young, who's from a partner of Marathon Venture Partners, well-known player in this space, and what did you learn from the pandemic?
Well, thank you, Erik, for the introduction. The pandemic has a huge change in the economic as well as the healthcare, ecosystem in China. And from the beginning of the pandemic, we firmly believe that the things that affecting the healthcare systems are coming from, first of all, is consumer demand. There are, before the pandemic, or during the pandemic, there's a growing demand for healthcare, providers. The second, I think the biggest change is, coming from the regulatory regime, either in terms of the payment system or the regulatory government body in China has changed a lot during the process of the pandemic system. And on the third, what we call, is the technology application. There are a lot of technologies, which, in terms of artificial intelligence, in terms of 3D printing, in terms of telehealth, that are fundamentally changing the landscape of health, in which that we found digital health has played a very important part in helping bring the inclusive into the whole kind of healthcare landscape in China. We are dedicating into three very specific healthcare infrastructures in China. Namely, we are trying to use digital technology to increase accessibility for people to interact with the doctors and the other healthcare practitioners to get more healthcare information and to get access to care. The second is about affordability. Actually, the prior panelist, Seth Zhang, Meditrust is one of my portfolio, and we invest in a lot of innovative payment companies, which is revolutionizing the healthcare payment systems in China. We are able to reduce, Seth's company as example, we are able to reduce the traditional commercial healthcare insurance from 5,000 down to 200. We are, providing the same kind of services. On the third, we are increasing the efficiency using technology, which is, as I mentioned, using artificial intelligence, 3D printing. That is actually some, in the time of pandemic, when the people face-to-face meeting is actually literally impossible, technology plays a very important role. Erik.
Okay, thank you very much, and that was a very interesting summary, I think, of what is a very dynamic sector in China, and of course, it wasn't always like this, and I think this has really been for me also an eye opener of what's happening in China. Can I move to Charles Dalton, Senior Health Specialist, IFC? And you're based in DC?
Yes.
So IFC has a long track record in health.
Basically what we've seen, and I think a couple of the other panelists have also already mentioned it, is that COVID has exposed many healthcare systems in terms of dysfunctionality, that many are still work in progress. And there are some core systemic issues that need to be looked at and understood. And I think from our perspective, we're looking at ways to now strengthen these systems And we believe that the private sector has a key role to play in that. Many governments are struggling with a backlog of underinvestment, if I can call it that, and that they need now to figure out how they can close the gap. And we see that the private sector has a role to play, but the private sector has a role to play also with the right business models as well. So we don't see the status quo remaining. We see that the private sector has to evolve and innovate and develop new business models to support the growth of these systems. And again, digital health has had its light bulb moment, if I can call it that. And there's a realization now, there's more acceptance by health professionals, there's more acceptance by consumers that digital health has a role to play in its broad in the broad definition of what digital health is. So we're putting a lot of emphasis now on looking at how digital health can be embedded as a system enabler. We're a little bit cautious that digital health outside of the system just creates more silos. So for us, it's, you know, how do you embed digital health into the system? And then importantly, how do you use data? Because I think healthcare in Asia, there's a lot of data, but it sits in silos and it might not be used as well as it could be between the payers and the provider service to get better value out of the whole system. So for us, that's what we've seen sort of coming out of COVID, is how to address the systemic dysfunctionality that exists, and also then focus on how the private sector can innovate and bring that innovation to strengthen the system. Thank you.
Thank you very much. And I think that is probably one of the main lessons, is that it has opened up all this, our sight to what is the weaknesses in the systems, and that different systems have different weaknesses, and also just basically the systemic approach that you need to think about this as systems, and you know, all these different technologies and different whatever it is, payment systems and so on. All that has to be part of a sort of systemic approach. Can I finally turn to Yun Qian, Head of Private Equity, China, Schroders Capital. I saw you, there you are.
Yeah, I mean, sure, I can share something from the LP's point of view. So yeah, Schroders Capital entered the Asian market more than 20 years ago. So they started from the TMT sector, then add on healthcare sector. The driver stays the same, basically the growth potential in Asia. So as a global investor, we want to combine the growth and the venture strategy in Asia with buyout and the venture investment in Europe and the US. So in which healthcare is a very important sector from asset allocations point of view. So I can only say that COVID pandemic actually further proves the resilience of this strategy from asset allocations point of view.
Yes, so maybe I can take we have a very short time allotted to us, so we have to be very quick, and I appreciate that you have been very succinct in your comments. But Charles mentioned the role of the private sector, and you know, going back to this question about, you know, from this pandemic, what have we learned about the role of the private sector? Is there some important lessons? Maybe Charles, can I get you back on that?
Yeah, just very quickly. I mean, from our perspective, we look at health crudely and broadly from four buckets. So we have our health service investing. During COVID, we've expanded considerably and understandably our life science focus, both on the manufacturing and the vaccine side as well. We've also expanded our focus on the medical equipment, and now we've created a strong focus on digital. I think for us, again, it's joining the dots, as I said earlier. So the private sector can play that support, both on the service side with the right business models, supporting the growth of the private sector and supporting government, but also on the supply chain distribution side. We've also noted a lot of gaps, as has been well documented, in terms of, you know, how to get goods and services to that end user, and then also utilizing that digital. So we've tweaked and updated our strategy, if I can call it that, by having those four confirmed buckets, because we believe all four make that contribution to the system strengthening. Thanks. Anyone
else want to come in on this question of you know, the maybe also the downsides of what we have to be worried about when private sector gets involved in healthcare. Anyone who wants to come in?
Well, I would like to comment from a little bit different perspective, is that about the private-public partnership. I mean, especially from my perspective in China, used to be that government controls literally everything in terms of healthcare providers, in terms of hospitals, as Seth mentioned in the earlier panel about the payments. So even right now, the governors, still relying a lot on the public side, but they are trying to trying to increase the participation on the private sector. But from the private participants' perspective, it's key and very critical by learning how to deal with the public side, especially with the government. For example, if you want to create the news, Seth in the earlier panel about what we call the city beneficiary insurance, it's a purely commercial, private paid, and a private practitioner of healthcare insurance. But the biggest driver here is that we are able to reduce the distribution cost of a typical healthcare insurance from 50% of the total premium to like less than 5% of premium. That is because of the strong incentive from the government to promote the private participants in the healthcare insurance sector. So we are able to reduce, that is the biggest reduction in the cost. And on the other example, what we kind of suffered quite a little bit is that we have a program that we are giving telemedicine tools for the rural barefoot doctors, which I would think is a great kind of incentive and have a great social needs. But during the pandemic, because some of the barefoot doctors, they could not follow the procedures of the government enforced lockdown period. So majority of the barefoot doctor clinics are closed. So that's, the private business side suffers quite a lot. So that is just showing how delicate for the private practitioners have to work with the public side. Just a comments to Charles on the incentive of the private sector perspective.
Jennifer, from your perspective, the things you care about in terms of inclusion and particularly women, how do you think the private sector fares in that regard?
Yeah, in that regard, I share Ray's view on the fact that if we look at it from a PPP perspective, in the countries that we're operating in Southeast Asia, particularly in Vietnam and Indonesia and the Philippines, where we have a public health infrastructure that needs a significant amount of upgrading and development, it is going to be important for the private sector to take a role. And where we've seen that playing out, where we've been investing in tertiary models, is the ability for the private sector, when we think about accessibility and patient empowerment at a time when there is such an out-of-pocket payer model within these countries, and then you look at fair and equitable access, I think there's an important role for the private sector in bringing together those three tenets. And we've seen examples where the private sector involvement has allowed a few things to happen, where we have a situation globally where we have a shortfall of say the numbers are correct, at around 18 million healthcare workers by 2020. It is going to be very important for the private sector to be playing its role in developing the talent within the healthcare system and building our education at the same time when we have new diagnostic and care pathways coming through. So there's a definite need for private sector to play that role, and the training that happens of workers inside the private system often benefits the public system as well, as those healthcare delivery teams work across both systems. Also in designing models showing that it is possible to deliver fair access in an efficient way. I think that leads to learnings that benefit the public system as well in these markets.
I think this is a very important point, that it's much more general than just healthcare, the ability of build state capacity by working with the private sector, learning from what the private sector does. And maybe, June, can I turn to you? Is it something that you recognize from your experience too, that private sector can be part of building the public healthcare system?
Yeah, definitely. So, I mean, I just echo what Ray just said, right? I mean, use China as an example. So basically, digital healthcare has already basically reached the primary physicians in most of the 400,000 like community, township, and village level healthcare institutions in China. Most of them are actually public institutions. So those kind of institutions are mainly in the low-tier cities with minorities area. So through those education enforcement, like service capability, as well as like data coverage, right? So private sector can help to bring those healthcare like inclusions from prophylaxis to follow up to the next level. That's also what we see here.
I mean, one thing that struck me when having a chance to look a bit more closely at the Chinese system, and particularly the sort of larger ecosystem that you have in China now, with both in pharmaceuticals, in digital health, and so on. And of course, it reminds me a bit of I used to live in Silicon Valley, and that there is a different approach sort of to intellectual property. There is a lot of sharing of information across entities, and so. First of all, is that the correct description? But maybe more important, is this something that could be brought to the rest of Asia, or do you think this is the Chinese model is too unique in terms of how it functions? Ray, maybe you can.
Well, there are three ways I can describe what the digital health enhancing the capability, providing in China, which some of them could be applicable not only in Asia but globally. For example, the artificial intelligence imaging. We invest in one company called the Qian Technologies, which is using artificial intelligence to read the image of cardiovascular CT image that we can. On the higher end side, that we can reduce a very experienced physician's time from 1 hour to the surgery operation preparation time, from 1 hour to like 2 minutes. So significantly reducing the time and the increased efficiency. So one doctor could cater to more patients on a daily basis. And on the lower case basis, we can educate and provide more capability to the lower tier doctors, which they do not have the capability, but we using the AI-enabled diagnostics, they have the capability and they can cure the patients right now. So a lot of them not only in artificial intelligence, but also in 3D printing, in robotics, in those technology-enabled inclusive health methods that we not only can help solve the situation in China, but also it could be replicate elsewhere. And the beauty is that in China, there's a lot of technologies are already, for example, 3D printing, not only in healthcare, but they are developing quite fast in the other manufacturing, which China is very strong. So the transformation of technologies from the other industries to healthcare, what we call the infusion, is happening actually much faster in China. And that could be applicable to the rest of the world. The second type, it could be more like business model type, which is uniquely happening in China, but could applicable to the other areas. For example, like in the previous session said, MediTrust, they are leveraging on the purchasing power to the big farmers and working together with the government. We can reduce the private insurance significantly. And we actually are working together with the MediTrust in Singapore, and we want to expand those technologies into Southeast Asian countries, which enjoy similarity that the government or the social security plays, or all the pocket plays a very important role, and we can reduce the percentage of out of pocket to transfer them to the private insurance. So those are kind of the inclusive models that we can, expand or just be more scalable in the other Asian countries. And some of the models in China are more specific. So there's a lot of business models coming out of WeChat, which is the social kind of, you cannot live without WeChat in China, but the other side China is kind of, you cannot find the business model work. So we have a lot of like telehealth and the communication with doctors and the medical knowledge surging on just based on the WeChat platform, which pretty unique, and it would be hard to replicate into Facebook or YouTube, Link, or other social networks outside China.
Charles, can I bring in you on both the lessons from China, but maybe also, I mean, there are other kind of hotspots of sort of healthcare ecosystems, like Singapore, for example, is what do you see the lessons, or the capacity or the potential for these to spread throughout Asia, or do you see other things that are important?
Yeah, I think there's lots of lessons to be learned, and also countries to watch as well, to see what we can learn from those countries. So a country for me to watch is Indonesia, because they've gone the whole social health insurance route. It's had its ups and downs. The private sector was outside, then the private sector is now working with it. So I think we can learn from that, of what works and what doesn't work. I think importantly for me, though, it's how do we drive more value within the overall healthcare system? So how can we be smarter in the way we deliver and in the way we organize, and also the way the public sector and private sector work. So we talk about PPPs, but I think what we are seeing in some markets, and maybe through social health insurance, the government is opening its eyes to new ways of contracting with the private sector as well. And I think that's going to be important, because that'll support the sort of the development of the trust and the understanding. One example I can give from our perspective in Asia, we have been looking at investing in entities that can support the strengthening and providing the operational backbone for social health insurance and private health insurance. We believe that there are entities out there that can put in place the right fundamentals for government to set up social health insurance correctly, so they can do proper data analytics, really understand disease profiles, really understand what the population demand is, use that data to negotiate pricing with pharma, use that pricing to set appropriate contracts to work with the private sector. So again, for us, I think we're beginning to see that in Asia. We're beginning to see the realization that it's a system strengthening and sort of building the jigsaw. But for us, it's also the importance around the sort of the data building blocks. Thanks.
Thanks, Charles. June, can I turn to you? How do you see this? Where are the important lessons, and what is transferable and what is not transferable as an LP? You're muted.
Yeah, so we see certain business models can be transferred from China to the rest of Asia, as Ray mentioned, right? So we see those cooperation between public-private partnership. I mean, because China, the public side in China is very, very strong. So, I mean, if there are certain cases in Asia, other Asia countries where the government the role infrastructure is strong, so I think those kind of business models can leverage well from Chinese experience. Other things is, of course, those technologies, and but I would be careful, because, for example, data part, China has a very large data available, so that AI technologies can have a very big space to play, while in other Asia countries, maybe their population size is not large enough, or maybe the data number is not large enough for those technology to be transferred. So I think these are the two parts I can see from the LP's point of view.
Well, thank you. I think this has been a dash through a lot of big issues and around what we learned from the pandemic, the insight, I think, that healthcare has to be treated as a system, private, public have to work together, making use of this push that digital technology has gotten through the pandemic to really create healthcare systems that are truly accessible and reaches all parts of society. So thank you so much, and I hope to see you in some other event in the near future. Thank you.